do you think I'm going to do? The first thing I'm going to do?
Tap the shoulder.
Before that.
Check
Assess the situation.
Yes, all right, and I'm going to stop, all right? I'm going to stop and I'm going to check the scene. I'm going to look for things because I didn't see what happened. So I'm going to be wondering, I wonder what happened here. Is there any broken pieces of glass, any sharp objects? That would indicate that there could be a wound that I have to deal with. Is there any water? Is there any electricity? Is it safe to approach, all right? So I'm going to be checking that first, and then what should I do? I need to protect myself, don't I?
Blood.
All right, I happen to have some gloves in my pocket, so I'm going to put my gloves on. Now, Tina, you're going to pretend to be unconscious. You can keep your eyes open if you like. I'm going to talk to you, but you're not allowed to answer me. All right? Okay. All right. So now I feel like, all right, I've stopped. I've assessed the situation. I feel like it's safe for me to approach. I've got protection. So now I'm going to approach my casualty. And now I want to tap her on the shoulder and see if she is responsive. Because I don't know if this is this normal for Tina just to lie on the floor like this? She might just be lying down. So I'm just going to check to see if she's responsive. So I'm going to do that by tapping her on the shoulder, and I'm going to give her a little shake as well. Hey Tina, can you hear me? Yes. All right, so you're not allowed to talk to me. All right. Can you hear me? No response, all right? She's not responsive, all right? So now I've determined she's not responsive. This is not a normal situation, and I'm going to need some help, all right? I want to call 999. So this is my time. I'm going to shout for help. Help, help, somebody help, all right? And while I'm waiting for somebody to come, I'm going to check to see if she's breathing normally. First of all, I'm going to open up her airway. Now, she's wearing glasses, so I want to remove her glasses at this stage. I'm going to put them somewhere safe. And then I'm going to open up her airway by doing the head tilt chin lift. So I'm going to have one hand on her forehead, two fingers on the bony part. Not here, because she'll be blocking off the airway, but here. So I can feel the bony part of her chin. I'm going to push down and pull up. Do you see that difference?
Yes.
That's a big difference, isn't it? Can we go back and do that again? So one hand on the forehead, two fingers here, push down, pull up. All right, so it's a head tilt, chin lift. Now, I'm going to look and feel for normal breathing. How long for? Do you remember? 10 seconds. Okay, so I'm looking to the chest to see if I can see it rising and falling. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. Excellent. She's breathing.
Watching you now.
The first her arms, everything okay. Look at her abdomen, feel underneath. Like that, okay. Nothing, that's all right. Just have a feel, no broken bones. Doesn't seem to be, no wounds. All right, okay, she's good. So, I don't want to leave her in this position. We've determined if she vomited, she could choke, right? We're going to turn her over onto her side in what we call the recovery position. So, you always want to turn the casualty towards you. You never want to turn them away from you because you have no control over the turn, okay? So I'm going to turn Tina towards me. So I'm going to take the hand closest to me and we're going to put it at right angles to the body. We call it the Hello Kitty Lucky Cat. All right, Hello Kitty Lucky Cat, closest to me. The opposite hand, we're going to take it and we're going to put the outside of the hand to the opposite cheek, and then I'm going to hold it in place. That's our praying hand. So, Hello Kitty, praying hand. All right? I'm going to hold it there because she's unconscious, she's floppy. If I don't hold it, it's just going to fall down. All right? So I'm going to hold it in place here. The opposite leg, I'm going to lift up like that. All right? And then I'm just going to pull on the knee. Just going to make sure she doesn't have anything in her pockets either. If it was a man, they usually keep wallets and keys and everything in their pockets, and then the keys could dig in and it could cause an injury. So just pull on the knee and turn her on the side. All right, Tina, I'm just going to turn you over onto your side, honey. All right, and you see how easy she comes across. Super, super easy. It's not hard. It doesn't. the little mouthpiece goes inside the mouth, like this, right? I open up the airway and I pinch the nose. Why do you think I pinch the nose? Yes, because we want the air to go into the lungs. If I don't pinch the nose, it's just going to come straight out again, all right? So we need the air to go into the lungs. And then I'm going to make a nice tight seal with my mouth around the mask here, around the mouth, and I'm going to do 5 normal breaths. 1, 2, 3. Do you see that I'm looking to the chest?
Yes.
I'm looking to see if it's rising and falling, right? Because maybe, I didn't witness it, it could possibly be a choking incident. If you don't get rise and fall of the chest, reposition the airway first of all, because if the airway is not open properly, do you see? It's not going to go in. You open up the airway, and then it goes into the lungs. So you do that first. If that doesn't work, you have a look in the mouth. Can you see anything there? If you can see it, and it's loose, all right, turn them on the side. It should fall into the cheek. They've told you to go and get the AED machine. You bring the AED machine and you come back and you put it by the person's head. You don't want to put it here or here. You don't want to put it here because hopefully there will be 2 people doing CPR and they'll be switching over. If you put it by the legs, the leads are not going to reach up to the chest, okay? And then this is a trainer, so I have to program it. But you just turn it on as soon as you bring it. So you turn the machine on, and it should start talking to you.
Call for help now.
Oh yeah, forgot to call 999. All right, so it reminds you to call for help. Remove all clothing from patient's chest. The pads have to go on the bare chest, so you have to remove the clothing. And the best way to do that is with scissors. You don't want to start trying undressing somebody because it's like undressing someone that's drunk too much, okay? It's very hard and very time consuming. With every AED, there should come a packet with some scissors and a cloth and a razor. So you take the scissors, and even if it's a lady wearing a very beautiful Chanel dress, you've got to cut through it, okay? So you cut through it, and you expose the chest. If that person has a hairy chest, if it's a guy with a hairy chest,
Shave it.
you're going to have to shave where the pads go, because otherwise the pads are not going to stick, all right? So the pads are going to go here. You can have a look. Where are the pads going to go? Okay, here and here. So you're going to just shave, all right? And you're just going to do it quickly. Just get the worst off so that it will stick. If you've had to drag them from the swimming pool, or it's hot in Hong Kong in the summer, maybe they're sweating, all right, and their chest is wet, there will be either some tissues or a cloth. You need to just wipe it. It doesn't matter if there is a little bit of water there, or if it's by the side of the swimming pool, or if it's on the beach, or if it's on a wet playing field, or even if it's in a puddle, you can still use this machine, all right? Don't waste time trying to pull this person to dry ground, because they're going to be a dead weight, literally, all right? It will be very hard. All right, she's just going to keep talking to me till I do what she says. If it's a lady with the bra on, you just push it up, or you can cut through it. Doesn't matter if it's got the wires underneath, you just push it up or cut through it, okay? So, you take the pads and you follow the picture.
Okay.
Check connector.
So you see, it tells me where they go. So this one is going to go here,
Supply pad to bare
like
skin.
that.
Exactly as shown
And this
in
one's
the
going to go on
picture.
the side here,
Heel other pad
like
blue
that,
plastic.
okay?
Supply pad.
The goal here is you don't put them on any lumps, bumps or scars, alright? You don't put them on lumps, bumps and scars. Now, I have to program this, okay?
Do not touch patient.
Don't touch patient, everybody stand clear, don't touch the patient. Evaluating the rhythm, don't touch.
Stand by. Preparing to shock. Everyone clear.
Everybody clear, don't touch, everybody clear.
Shock delivered. Provide chest compressions and rescue breath.
Okay. And you carry on doing chest compressions. Now, somebody would have been doing chest compressions whilst you were opening up the AED, getting it all sorted. So they just keep going. They keep going while you take the pads and you put one pad on, and then they can carry on and then you're peeling that. Somebody's told a funny story when you were eating. Oh, Tina! Oh, gosh, are you okay? Just keep coughing, all right? Cough it up, cough it up. There's a good girl. Okay, all right. Oh my gosh, Tina! Are you joking? Are you joking? Okay, may I help you? All right, I know what to do. Okay, so you want to ask your casualty if you can help them. All right, ask their permission, get their consent. Right, so I'm going to stand slightly behind her and put one foot in between her legs. The reason I'm going to do that is because if I can't get that out, she's going to collapse and become unconscious. I can use my thigh muscles to gradually lower her to the floor and then start CPR. And then I'm going to support her around the middle and I'm going to bend her over because I want that object to come down and onto the floor. Then between her shoulder blades, I'm going to take the heel of my hand and I'm going to give her up to 5 back blows. So, and I would do it hard, but I'm not really going to do it hard, okay? So it will be 1, did it come out? No, 2, 3, 4, 5, all right? Now, how hard I would hit would be dependent on the stature of that person. So Tina's quite, if it was a big burly guy, I'm going to hit him really hard. If it was a child, it would be a little bit less, and I'd probably have to get down on my knee and put the child over my knee and then hit them on the back, okay? So it didn't come out, so now I need to do abdominal thrusts. If it was a pregnant lady, so let's pretend you're a pregnant lady, Christina. I would be able to do the abdominal thrusts, all right? Because the baby's going to be there. So I would have to do chest thrusts instead. So you sit them down, you bend them over, support them, do the back those the same, but instead of doing abdominal thrust, you're going to go make your fist and center the chest where we were doing our chest compressions, and then you're just going to go in, 2, 3, 4, 5. Okay? Yeah, right where we, remember where we were doing our chest compressions?
Yes.
That. Right in the middle. And then you're just pressing in, okay? And you would also do that if it was somebody that was really obese and you couldn't get your arms around them. Or maybe they were really tall and you're really petite and you can't do the back flips, okay? Thank you so much, Tina. All right, so what I want everybody to do